I don't know about you, but have you seen those miracle ads where they say, here's the cure for X, and you click and you have to go through like 20 minutes of listening to someone say something to get to the end and they say, buy now, and you have to keep paying for things and it turns out it's not a cure, sort of the crazy stuff. Well, believe it or not, there's a lot of not crazy stuff out there. And I sat down with Jennifer Ashton, a doctor who I've known for years. She worked with me at another network, and we talked about what is actually a miracle drug in many ways, and that's those weight loss drugs. Dr. Ashton is board certified in obesity and OBGYN. She's really, really, really smart. And I've seen a report to say that it's not just weight that you lose with these weight loss drugs. It has so many other benefits. It has benefits for your heart. Now they think liver because it's an anti-inflammatory. But it's fascinating to find out what these drugs are doing, and maybe it'd be helpful for you. I certainly wanted to hear from Jennifer Ashton, and since I've known her forever, we talked about other things as well. So here's this podcast with Dr. Jennifer Ashton, and you'll recognize her. She was on TV all the time. She's been on every network, and like I said, she's really, really smart, and she's really nice. Dr. Ashton, very nice to see you again.
It's so great to see you, Greta. We should do this more often.
No kidding. I call you Dr. Ashton, but the truth is we're old friends.
Yeah, very, very old.
Very old. Yes, we're getting older and older friends. Okay, I want to talk about GLP-1. First of all, why does it have to have a name like that? Why isn't it just like something easier for the rest of us? I had to look down at my notes.
Right. I know. I mean, you could also call it incretin therapy. That's probably more accurate now that there's GLP-1 and second generation and third generation. So, if you're talking about one of the newer medications, it's not really accurate to just say GLP-1 because there's multiple receptors involved. So incretin is probably more accurate.
Do you know what my trick is on all of this stuff? Is I go on, I'll say like, what's a hormone? And it gives me some on AI, and it gives me some crazy thing that I don't understand because for a lot of reasons I don't understand. So then I say, please explain a hormone to a fourth grader. Then what happens is I get the best explanations in the whole world, explaining what, hormones. I think of it like being in a big school and you've got a messenger who has to run around and do all these things. I mean, but that's the way I like to learn.
That's perfect.
Yeah, it's great. All right, now I'm going to read you some of these things. Ozempic, Wegovy, Zepbound, Mounjaro, Saxenda, Victoza. Are they all the same?
They are the same class. They're the incretin class. The dose can differ. The route of administration can differ. Now there's Foundayo, which is the newly FDA approved pill form of GLP-1, just newly approved, I think 2 weeks ago now. So they all are, you can consider them as cousins with the same last name.
All right, but if you go in to see a doctor for a problem, I mean, does a doctor I would, listening to you, they must have certain ones are good for certain problems more than other ones, or is that not necessarily true?
Not necessarily true, because we're learning more and more about the unexpected, in many cases, downstream effects of these medications. Unfortunately, in the media, you hear a lot about possible side effects and risks and adverse effects, which is always important to consider when you're talking about any medication. You don't hear as much about the unexpected positives. It is out there. People are covering it, like you. But a lot of these positive benefits, if you will, to this class of medication are being found by serendipity because so many millions of people are taking them. And now finally, they're all under a microscope. And so if, one of them finds that their hair is growing more, that's going to be a headline. But we've known now for some time that there are a lot of positive, beneficial effects that have nothing to do with weight loss seen with this class of medication.
Well, the one that was sort of prompted my wanting to talk to you today is the liver. I read that it might have some benefit for the liver. Now that's brand new. I hadn't heard that one before.
Yeah, and that's research that just came out of Canada, actually. And, other people are looking at that as well. And, to get into kind of the mini med school of that whole process, first we have to go back to what was found when people with the conditions of overweight and obesity took these medications. Now, yes, the number on the scale went down, right? That's not a surprise. Most people are aware of that kind of as an end result. But as they were being followed appropriately by a physician, not like a medi spa kind of, phone in order left to DIY this medication, they were also being studied for other things. So, how was their heart doing? What inflammatory markers that we can test for in blood were changing, going down maybe? And the liver is one of those things. So, we know that people who are overweight, have overweight and obesity, are at higher risk for something called fatty liver disease. And this is metabolic associated fatty liver disease. It is a major, major problem. We don't talk about it enough. Anyone in the field of obesity medicine knows that this is a significant issue with anyone with a weight condition. What researchers in Canada found in mice is that when mice were given these class of medications, they were having independent improvement in their liver cell function that had nothing to do with pounds lost or weight, or in the case of a mouse, ounces lost. And that is really, really interesting data. It supports the kind of other positive side effects that are seen with this class of medication, like reducing systemic inflammatory markers and having an improvement on your immune system. And now, really, for the first time, we're seeing that, yes, liver cells do have GLP-1 receptors, and this medication is working on those cells to kind of heal from a chronic liver condition, which is really, really interesting.
And you can have this problem without being obese. I mean, because most of these people are, you think of like heart problems where you need to lose 20 pounds, and that'll help a lot. But I mean, so you think that that's why it helps the heart, because it helps you lose the weight. Are these medicines helpful regardless of your weight?
Well, there's a lot of emerging data, again, both in animals and in humans, that the answer is yes, because of their effects on inflammation, on the immune system, on particle size of our cholesterol molecules, all positive kind of effects that have nothing to do with the number on the scale. So, the potential is that these then can be formally studied for those indications, eventually, hopefully get FDA approval for that, which will then trigger that cascade of insurance covering it for reasons that have nothing to do with the actual weight a person is, which would be interesting.
Are they anti-inflammatories?
Yeah, there's a lot of data. There's a lot of data that these drugs have a very powerful anti-inflammatory result. It's not totally clear why or how that occurs. We don't know whether that's the cause or the effect, so to speak, or putting, the chicken and the egg. I'll give you an example that you and I have talked about actually with these medications offline, in our private life. But, a lot of people on these medications, it's well known, well reported now that they tend to consume alcohol less, right? It just kills the drive for alcohol. And that for many / most people is a good thing, right? So what happens when you consume less alcohol? Well, that lowers your systemic or overall inflammatory level just in and of itself. So we're starting to do the basic science as well as clinical research with these medications now that can help tell us how much of what we're seeing, let's say, whether it's with the liver or with your inflammatory markers, have to do with changes in behavior and how much has to do with the drug specifically in and of itself, and how much has to do with both. And right now, that's not totally well known, but it is known that there's a really significant anti-inflammatory result with these medications.
Well, when I had back surgery, which was, by the way, robotically, which was extremely successful after suffering for forever. But I used to get cortisone shots in my back, which would reduce the inflammation. And they work for 6 months, then they work for 3 months, and they work for 2 months, and they work for an hour. I'm obviously exaggerating, but would that have, are these drugs likely to have that sort of systemic anti-inflammatory so that someone with a problem like that might see some sort of relief?
Well, the short answer is yes. And I'll give you another example of a specific kind of subset population that's already being formally studied with this class of medication. But people with a certain type of psoriasis that are on autoimmune medications, to kind of help that condition, when they're on a GLP-1 medication and an autoimmune medication together, they have a better resolution in their symptoms than people who are just on one alone. And certainly when you're talking about certain types of psoriasis, the autoimmune alone. So there does definitely appear to be some synergistic effect when these medications are combined with others. But I don't think we fully appreciate how and why there's such a strong anti-inflammatory result here.
How about arthritis?
Yeah, I mean, that's been anecdotally reported. Again, what's unbelievable is that now when you're taking this and the effect of people losing a small amount of weight, so we're not talking about people who have obesity or have overweight and need to lose, let's say, 50 pounds. Let's say someone loses 5 pounds, 10 pounds, which may or may not be the equivalent of 5% of their starting body weight. People are largely feeling better already, which really does suggest that part of the mechanism of action of these drugs really has nothing to do with dropping the number on the scale.
And of course, I can't walk in and say, okay, I have a bad back of arthritis. I'd like to get this GL1P, or whatever, what is that written down again?
GLP-1.
Whatever it is. I went to law school, so forgive me. But the doctors can't give it to you because it's off label. Or it's not, or can they?
So they can, but you're correct, it is off label. So what does that mean? That means that this should go on anyway. There should be an informed consent process where the doctor explains to the patient, I'm going to suggest that you take something. It's off label for the reason I'm suggesting it, but it may help. Here are the benefits. Here are the possible risks. Let's decide together. That's the appropriate informed consent procedure that should go on with every medication, not just one that's off label. But, I just did a live Zoom, an hour ago, and I was talking about this very issue. And the example I gave is that a lot of people will be familiar with. Women, birth control pills have been used for 35, 40 years off label as a treatment for acne. They've never gotten an FDA approval or indication for that, but they are used every single day by dermatologists and gynecologists and healthcare professionals to treat acne. So just because something's off label doesn't mean it can't or shouldn't be prescribed. It does mean that insurance may not cover it, which is a whole other factor and conversation. But a good provider, who has experience treating X, Y, or Z will be very familiar with not just what's on label, but also what's off label.
Can you overdose on these?
Absolutely.
What's the overdose? You get overdose, I assume that you get so skinny, you look like you could get so skinny to be one way, but is there some other manifestation?
Well, I would call that, being emaciated or getting to an underweight position, to not be really overdosing per se, but misusing or misdosing. Because remember, like any medication, these drugs have a dose, they have a frequency of use. And that comes with the FDA approval. I mean, that's what's on the package insert. That's what was formally studied, but that is not written in stone. And when you have a good, experienced healthcare professional, so not a strip mall or medi spa that's
I
just
thought you were going to say a stripper, but go ahead.
not I mean, a stripper could be professional,
Yeah.
could be credentialed.
Whatever. Yeah.
We don't want to judge, but not like a strip mall or med spa that is just going to charge you for these medications and not have the expertise and the experience of actually following you with them. But most of the side effects we see with this class of medication are dose dependent. So even people who say it made me so nauseated or I was vomiting, usually that can be avoided, again, by individualizing the treatment. And for example, instead of repeating the dose every 7 days, which is normally the practice because that's the half-life of these drugs in injectable form, you could say, you know what? These drugs stay in your system for 5 weeks, actually, not 1 week. And so, let's see how you do if we repeat the dose every 2 weeks instead of every 1 week. That's an example. Lowering the dose and keeping it low for a long period of time is an example. But a lot of the side effects, the common ones, can be avoided with lower doses and more individualized kind of management.
But seems to be, I hate to use this word, but almost like a miracle drug because inflammation is such a problem with so many diseases. And if, that's why to me it seems like a miracle drug.
Well, a lot of people share that opinion. I'm one of them. Do I think they should be less expensive and more accessible for people? Absolutely. Do I think they can be dangerous in some people? Sure, like anything. Do I think they can have some serious side effects randomly in some people? Of course, just like Tylenol or aspirin can. They're not candy. They can't be, this isn't for DIYing it at home just because they're so available. But I think that when you recognize that 70% of the US population has the conditions of overweight or obesity, 70, and all of the known adverse consequences of that, especially as we age, I think when you look at the 20 plus years of scientific data and clinical use of these medications, because they were first FDA approved in 2005, I think it's very easy to say for those people in that population, the benefits outweigh the risks. That doesn't mean the risks are zero. That doesn't mean they're for everyone, but I believe they have a significant role, not just in treatment and management, but even in prevention for a lot of people. And I don't think we've begun to see the tip of the iceberg with that yet.
Well, it's interesting. Before I had my back surgery, which as I keep saying, it was such a great thing. I had it done robotically, so I was back at work in 5 days, 4 screws, 2 bolts,
Typical.
plate. It's amazing. But is that for inflammation, I was told to take Advil, but don't take too much because you'll get stomach ulcers. So I'm trying to beat the inflammation in my back with Advil, but I'm trying to avoid ulcers in my stomach from taking too much.
Right. I mean,
but
and
this seemed like it might have been an option.
Well, remember this it looks like it has a real place for chronic inflammation, not acute like surgical or post-op inflammation.
No, I mean this would be. I mean, I'm thinking about the years leading. For 5 years I suffered with my back.
Yeah. Well, I mean, it's possible, but again, I will tell you that it is being looked at quite literally for every associated endpoint that we have right now, and as we should, because that is how a lot of discoveries in medicine and science occur, by serendipity, something that we use all the time, and then we see, oh my gosh, it does X, Y, or Z, and then we start formally studying it for that. And look, there are people who have their, very strong feelings, which they're entitled to, about pharmaceutical companies. Last week or 2 weeks ago, rather, I had the kind of good access to interview the CEO of Eli Lilly right around the time that the FDA approval for the GLP-1 pill came out. And I will say, because you know how we like sunlight in the world of media, right, Greta? I am not paid by Eli Lilly or Novo Nordisk. I purely interviewed him for journalistic and medical kind of information purposes. These drugs, I think, could change the health of the planet. Okay.
Well, but the other thing too, I mean, it's a little insane if someone's got a heart problem because of weight. It's a little insane not to like take the weight off, because the cost of heart is much more, it's going to be a fortune than it is for these pills and the shots. I mean, if we use sort of common sense, if we can head it off at the pass, possibly, because we're going to pay a fortune, not to mention the heartache and everything else when someone has a heart attack or needs a heart transplant or whatever. And we can't seem to get with all the, I mean, I think drug companies should be rewarded for their research and everything.
I'm glad you mentioned that, because there's two issues, and I heard a lot of comments, valid kind of opinions from my post. I put it on my Instagram, by the way, at DRJ Ashton. People can watch it back from, I think it was 10 days or 2 weeks ago now. People look at things in a very binary way. Either pharmaceuticals are good or evil. The government is either good or evil. Doctors are either good or dumb. It's not that.
You put lawyers in there too. Go ahead.
Okay, right, exactly. It's not that simple. There's a lot of gray zone. There's a lot of nuance. I agree with you that pharmaceutical companies are not nonprofits. It costs them about $3 billion to develop and bring a new drug to market. And it over 10 to 20 years, right? They deserve to financially get that money back. Right. And I want them to make money.
And you got taken the drugs that they are investigating that don't turn out to be good too.
Which is the majority, which is about 90%. They deserve, in my opinion, to get that money back. Now, I think that the government has a role in making this more accessible, but no one talks about the insurance companies. They have a role to make this medication or any other, not just, oh, great, we've got a good medication that works, but now let's cover it. And you mentioned a very important and sophisticated, nuanced point, which is that when insurance companies and the government wake up and realize that when the curves cross of how much it's costing them to treat with a GLP-1 versus how much they will save with preventing the consequences of weight conditions that aren't treated, then I think they'll wake up and say, oh, now we'll start covering them. And I think that's a shame. But I don't see the pharmaceutical companies as the villains here. If anything, the insurance companies have a real obligation, in my opinion, to cover more of these medications for the people who want and need them.
Yeah, and there are a lot of people doing it. I mean, like even going back to my back surgery, which I always go back, is that, I'm lucky. I have insurance. I could pay for it. I see people rubbing their backs, and I know that they have the same pain that I had for so long. If I'm standing in line at the grocery store, I'm thinking to myself, that person doesn't look like he probably has the insurance or knows how to find robotic surgery,
Right.
And I think of that poor guy because I know what the person's going through. And the same thing with weight. I mean, even self-esteem is so important. People who have extra weight, it isn't because they're necessarily don't care. It's that, they need a little help somehow to lose the weight, and then they better. Everything.
I'm gonna tell you, I think the last time we saw each other in person, I was telling you about my wellness experiment, right? For Agenda. So we have almost 15,000 women. Men could join too, but so far they haven't. It's all women. And I partnered with a professional trainer and put together a daily meal plan with high protein, high fiber, the appropriate amount of calcium. I give the recipes, the meal plan. And then I put together the daily workouts with this professional trainer, and we have changed people's lives. They have lowered their cholesterol. They have lost 50 pounds in some cases. But guess what? It's not either or. You have to do the behavior, and some people may want or need a medication in addition. So I think, when you think about that and you know how powerful behavior is, we need to be able to walk and chew gum at the same time. We need to be able to say, yeah, the fitness and the food, that's key, that's foundational. But the medication might need to be there too for a lot of people.
It gives you a little win, a little drive. I mean, a little like, like it's happening. I mean, look, if I hear one, everyone says, to people who are weight, get more exercise and eat less. Well, that's just like, forget it. I mean, give them a win, help the person.
And not just a win, kind of psychosocially, but I will tell you, Greta, and you know this, I've been board certified in obesity medicine for 10 years, exactly 10 years. And I just took and passed a recert exam. So when people say they're obesity experts or weight management experts, the question to ask is, are they board certified or not? Yes or no? This is not a new exam, right? And I will tell you that for 10 years, it has been known, more than 10 years, it's been known that people who struggle with their weight, it is not due to one thing. It is due to probably 8 or 10 things: genetics, environment, behavior, in some cases, medications that they have to be on, which cause weight gain, our crappy food supply. You keep going down the list, right? To say to someone, eat less and move more, reflects a fundamental lack of understanding of actually the fact that obesity is a complex, chronic, and multifactorial disorder, no different than diabetes. That's just the reality.
Well, sometime I'd like to talk about another area, but I'll give you a clue about it. Is elevated lipoprotein A, because I have a family member who has that and had a heart attack.
Yeah.
And there is now a new medication coming out, but it took a lot of pushing on our family side to get it. And most of the population, 15% of the population, has an elevated lipoprotein A, walking around the time bomb in their chest, and they don't know it. And they're not going to get the medicine. That's the one thing. And also the red light saunas, or whatever they're called. What are those any good?
Wait, did you read my newsletter today?
No, I didn't get a chance to. I got up late today. Did you write about it?
So in the newsletter today, I mean, I can't believe the cosmic.
All right, tell me, because
is stuff about low, near, and far infrared saunas and the science. I call it the science behind the sweat in today's free newsletter, and GLP-1s. So when your producer reached out to me, I said, "Oh my God, this is like psychic." Did Greta read the newsletter?
No, I haven't read any of my emails today, which is terrible. I got about 150 I have to read.
Well, you're going to see it in there.
Well, I'm going to go as soon as we finish this. I'm going to go read it before I do get ready for my show.
Well, listen, there's good, not excellent, but good science behind sauna, both dry sauna, Finnish sauna, and IR saunas, and associated health benefits. Most of the data is based on observation, not cause and effect. However, we do have plausible mechanisms that can explain why it's good for us. Do you like saunas?
I like steam showers better.
Okay.
But I'm thinking about getting one of those saunas.
You should get one. And by the way, in my newsletter, there's a really great company that extended a discount to anyone who orders one through my newsletter.
But I mean, you can get a one person, like a phone booth, or you can get a 2-person.
No, get a bigger one.
Get a bigger one?
Yeah.
But it works.
There's a lot. Listen, not only is it low risk, high benefit, you're going to feel good. There's a lot of published data about the way that it's beneficial for our health, especially as we age, for frailty, even for people with cardiovascular issues, and especially for those people, the effects on the blood vessels. I love it. And literally it's in, my newsletter's free.
Yeah, I know. People should pay. I get your newsletter, but I don't pay
Okay,
for it, so
good.
I know it's free. I
That's
know it's
right.
free, and more people should get your newsletter.
That's
They're
right.
going to after this.
So
Um,
today it's GLP-1s, it's saunas. There's a good recipe in there that you and
does Uber Eats deliver that?
no,
Oh.
unfortunately. But listen,
I'm a vegan. Come on, I do well. I'm a vegan.
I know, but I'm a bad cook, and so the recipes I put in there.
I've watched you do recipes. You look like you're doing a good job. I've watched them.
Well, I may be doing a decent job, but I hate to cook. So any recipe I include in there is super easy.
No, but I've watched you do those recipes.
Well, I mean,
Um,
listen,
all
you
right, but
should
let me get
dig
back to
in.
the sauna.
Yeah.
It's good. It seemed to be good for everything. What I read, the heart, arthritis. I mean, it was like the next. It was
Yeah, your mood, it activates something called heat shock proteins and the genes that turn on those proteins. So it has a beneficial effect to our blood vessels, like all over our body. And then, you're kind of also releasing some feel good, kind of like serotonin, like neurotransmitters that just make you feel good. So it's relaxing. Don't get excited when I say this because I know you do your exercise, but there are a lot of ways that it can simulate exercise, the
exercise.
same effects as exercise. You still need to exercise.
I don't exercise ever since I'm back surgery. I'm afraid to do exercise.
You need to lift weights. Don't make me come and do a house call. Ever since I gave your husband that flu shot about 15 years ago, I've been threatening I'm going to make a house call and I'm going to change.
All right, okay,
Everything.
all right, let me just, I won't keep you much longer. So what weights would you start at?
It depends who it is. You're
I'm
a
talking
tank
about me. I'm talking
person.
about
Oh, you could probably start with 5 pound dumbbells in some things, but
and do what with them? Just this?
no, not just that. Lunges, squats, bicep curls, back exercises, all.
What about instead weights on your wrists and ankles instead?
I wouldn't jump to that first because you probably don't have the muscular strength to prevent an injury from that. So that's good for
That's
someone who
it's because I haven't
already,
been exercising. That was a
right.
nice way to say I haven't been exercising. I'm lazy, but go ahead.
That's good for someone who has a good foundation for some
Who's
things.
not lazy?
No, you're not lazy. But anyway, the key is lifting weights. You have to by the way, for men also, all of us from with age, and it really ramps up starting at age 50, sarcopenia, the loss of muscle mass and function. And it's not about how light or skinny or small you are. It's about how much power you have in your muscles as an organ system. And so you have to put stress on your frame to do that. You have to lift weights.
All right. Well, now this is one last question. I'm gonna go read your newsletter, but does it tell what kind of it recommends a sauna, but I assume there are different speeds or temperatures or time you should be in it.
Most of the data says three sessions a week for
Okay.
about 15 minutes each time. But again, you do what you can handle depending on the temperature of the sauna, the kind of sauna. Those IR saunas are easier to spend more time in because they heat you up from the inside out. It's not about the air, as it is with a Finnish or dry sauna. Those saunas, most people will kind of cap out at 15 or 20 minutes.
Good. All right. Thank you very much. I'm going to get some weights because I'm properly shamed. They may sit in a box, but I'm at least going to order them. That's the first step.
No, they can't sit in a box. We
I,
need you around for another, I don't know,
I,
20 plus years.
I've got an overweight dog I have to lift all the time too. So that's my part of my muscle training. Poor dog, she's 15. She's an older girl, older gal.
How much does she weigh? Is this Audrey?
Audrey's long gone. We have now Dottie, who's 15 and overweight. Annie, who's 7, and
Annie.
Annie, who's 7, and Charlotte, who's 2.
What about the cats?
We're down to 3 cats, and we have my Bill, who named after Bill Shine. We have Bill Shine, Yeah, now he's about 18. Bill Shine, of course, who is our senior at Fox News Channel.
Yeah.
Then we have Nick, who's a rescue. He's 6. And we just got Jack in November, but there's a serious problem. Nick hates Jack. Doesn't dislike Jack. He hates him. Back when we walked on the moon in 1969, my sister had made a bunch of peanut butter cookies, and I ate so many I got sick. So I always remember the moon landing. I haven't had a peanut butter cookie since. So the other night when John and I were sitting in front of the TV watching the splashdown, it was very exciting. First time in 50 years. Just before they hit the water, right behind us was the world's worst cat fight you've ever heard in your whole life. I'm surprised you didn't hear it where you are. It was so horrible because if Nick sees that Jack, just he goes nuts. He hates him so much. So we're doing a lot of we're working on it at home.
Can I introduce a cameo to that?
Yeah, Mason.
Yep. You've met Mason.
Oh, let me see Mason. Oh, I love Mason. Mason's a beauty.
Look at me.
Mason. How old is Mason?
Mason's almost 11.
Oh, what a handsome dog. Well groomed, not like ours.
Well, he's looking a little like he needs some spa.
Actually, his hair sort of looks like mine. It's just
well, I know. That's what I always say. Like I have the same colorist as Mason.
Well, I have the same hairstyle.
How cute is he, Greta?
He's the best. He's the best. Anyway, as always, I'm going to go read your newsletter. And just for others who want to read your newsletter, tell me right now how to read your newsletter.
Thank you. Well, first of all, they can go to joinagenda.com, and agenda with a Jen, not a G, like Jennifer. Joinagenda.com. And then I always put stuff about my newsletter links and whatever on my YouTube channel, which is at DRJ Ashton, and my Instagram at DRJ Ashton. So anything that I do kind of comes through the Instagram first and trickles down.
Well, I see the cooking on the Instagram. Actually, when I see that, I think like, man, how can she do that?
Oh, no. I'm horrible at cooking, and I don't like it.
But that's just more humiliating to me if you think you're horrible when I can't do the horrible. Do you know what I mean? It's just more humiliating.
No, I mean, we're all in the same pot. It's just a matter of where we are. Anytime, Greta.
Anyway, thank you, as always. Thank you very much. Nice to see you.
See you soon.
Thank you for listening to Greta Wire. Be sure to subscribe on Apple Podcasts, Spotify, or your favorite podcast app. If you like the show, be sure to leave a 5-star review. You can watch episodes of Greta Wire each week on Newsmax's YouTube and Rumble channels, Facebook, X, and Instagram. Email us at emailgreta@newsmax.com. That's emailgreta@newsmax.com, and we may read your email on a future episode. Thank you again for listening, and we'll be back next week.